Are you tired of a podcast that only entertains you without leaving you with something to think about? Are you looking for a podcast that truly enrich your life? Then Let's Talk is the show for you. Our motto is to make people think after every episode, and we take that mission seriously. Each episode is carefully crafted to provide an insight and ideas to help you live a more fulfilling life. From practical tips for improving your mental and physical health to thought provoking ideas and discussions on personal growth and development, Let's Talk has something for everyone. Our guests come from a variety of backgrounds and bring wealth of knowledge and experience to the table. We believe that everyone has something to teach, and we are committed to bringing you the best insights, ideas from the wide range of perspective. So, if you're ready to start thinking more deeply about your life, how you can make it better, then Let's Talk is the podcast for you. Subscribe today and start enriching your life one thought provoking episode at a time. Welcome to Let's Talk Podcast. So let's quickly change a gear towards a bit of the work in terms of leading these opportunities, or in general, the leadership approach you mentioned about the clinical trial. So now we will talk about a leadership in general. So you mentioned about that. Okay, they are these the exceptions of black swan event. Now this can happen for each and every leader. They are managing a team, they are managing a particular organizational arm, or any of those things which they have done a lot of research, but something like these black swan events happen out of the blue. As a leader, as a visionary, what's your perspective or advice to the people who get into these events which are totally unfounded and they just came, and then you have to take some decision or take the step to bring the overall organization with you? So what's your advice on that?
Yeah. So as you know, with COVID coming together, we all went into a new model of remote working. And as soon as people went to do remote working, there were lots of conflicts. You're now working at home. You have kids to take care of. They're not going into school. You have multiple couples working, smaller confined spaces. And the whole dynamics of the workforce environment completely changed. People had to change how they behaved as an organization. The organizational view of meetings, accountability, timings, expectations all had to be framed a little different. So one of the key things I had to do with my team was, how do we create the right empathy? Everybody talks about leadership in different ways, but really understanding the context. You're in an important meeting and the dog barks. That's okay. You're in a meeting and somebody has to attend the door, or the kid is crying, or you have to do other ways and mechanisms. And so you really have to build an empathy structure around how people will work, their situations, and then still bring the teams together to get things done. Now, the good thing about a Black Swan event like what we're talking about was everybody was proud and privileged to be part of solving that. So when we were going after these vaccine trials, I would say that my teams were working long hours across multiple time zones, but they all had a very good sense of purpose. They all felt like they were part of the solution and that their work was going to make an impact. That's very fulfilling. So when you compare a mission and purpose with empathy, you have a lot of good EQ coming from your team and a lot of good success. Teams were working for a strong purpose, but looking beyond the blemishes of how you go about doing it. So, as a leader, you have to encourage. I tell my team, my job is only to do two things. One is to remove obstacles in front of you, and two, to be a cheerleader behind you. And I truly believe in that leadership style. And as you can do that, you have to, of course, hold your teams accountable to a larger purpose. But once you have done that, you just have to play the role of removing obstacles and then being the cheerleader and shining the spotlight on them. It was very difficult times. We had quite a lot of challenges. Technology was in the forefront of many of the vaccine trials. And there were success days. There were days when the technology didn't work, but I would say that the team just pulled through because they had an amazing sense of purpose and an amazing sense of team collaboration to make it happen.
Sense of purpose, collaboration, accountability. I think these are important things to lead any team. As I think you rightly mentioned that if you tell people what to do, they might do it. But if you tell people why to do certain things, then you will see that the amount of, I would say, a passion and inclusivity towards a work will dramatically change because now they can associate. There is, I think, there is a book from Simon Sinek about why. I don't recall the full name, but he explained beautifully that in the organizations, it's so important to let people know why leaders are doing certain work, why they are telling about certain things, because there's a human tendency that when someone tells you something about it, whether it's a leader, whether you are parents, whether someone elders, or even if you're same age group, there's always, I would say, a psychology of resisting things. Very first thing, before maybe you can try to calculate and try to be more, would they empathize or something from that perspective, or try to have that learning mindset. So yeah, once you know why, then most of the things resolve. But obviously, it's not easy from that perspective. So, so in taking that thing into the consideration, what's your aspects about what do you tell people whom you are mentoring, or maybe your peers, of taking risk in terms of creativity and innovation? Because in health and life sciences, apart from just following the status quo, you also encourage a lot of people to be creative and innovative. At the same time, there should be some boundaries as well, because you cannot just say that you are being creative and not providing the productivity what the business also demands. So what's your perspective of having that balance in terms of the innovation creativity at the same time meeting the business goals?
Yeah. So innovation is a very important word. So how do you drive innovation? So I say there are different types of innovation. Of course, there's breakthrough innovation where you're completely rethinking how certain operating models go. That's on one end. And there are what I call incremental innovations, which you can do. So I don't think you need to outsource innovation or say innovation has to be done by a group or somebody else or some other thinking and people do their routine jobs. My biggest challenge is I challenge my team to saying, how do you innovate what you're trying to do? You're close to what you're doing. What are things which you think should be eliminated? What are the things which should be automated? What are the things which should be completely removed? We know much better. And so I say innovation does not have to be with a think tank, through an AI group, through somebody else. You could start to drive innovation and everything which you're trying to do. That's one part. In the meantime, you're always having somebody look at the status quo and saying, what can we do better? What should we be doing to remove? For that, you need to be very close to the market and keep listening to what's going on. Several times people say, I know better. But actually, in the healthcare industry, the patient knows better, the sites know better. They are the ones who are using technology, they're bringing things together. So, spending more time in looking at what are truly friction areas and how and why we're doing certain things is also important. And the third part of innovation, at least in our industry, is around regulatory. That is a given because if you innovate and you cannot defend it in front of the FDA, defend it in front of EMEA, then it is not useful. So several times we see a lot of techie or tech companies coming and saying, "Oh, this industry is not innovative. Let me come and innovate it." They do what they did in other industries, and then they hit the roadblock because they've not thought about regulatory considerations, the importance of GXP, the importance of audit, as we talked about, the importance of privacy, importance of all of that. So I would say that the operating word in life sciences is you need to have structured innovation to the job you do, structured innovation to the ecosystem you're impacting, and structured innovation to bringing in patients, sponsors, and sites together in a better way.
Agreed. So, which brings me a follow up question. As you mentioned, that innovation has to be corroborated or supported by some evidence as well in front of the people who are managing the industry or try, as you mentioned, it's a heavily regulated. Which brings to me a question around innovations are not always acceptable, or I would say appreciated, right? When we say innovation, in terms of saying something about, okay, maybe I mean, when the scientists in yesteryears have created some, provided some algorithm or some theory, there definitely would be a lot of oppositions. And so in those scenarios, I think it may be a fine line between accepting what you're saying versus kind of supporting, or I would say proving a point in a way which is acceptable to the people. Because again, coming back to, it's again a black swan that if people do not link to their experiences, they may not be able to understand that, or if it doesn't look logical because it has not been proven yet. So, in that perspective, how do we go about it? I mean, what is the fine line between the innovation on the existing technologies or innovation on something which is untested waters, which we have really have not seen so far, and it brings a lot of disruption or maybe totally neglected by the industry?
Yeah, I mean, I'll give you a good example. So, treating patients at home that used to exist before COVID, but people would say, it's too difficult, it's too costly, nobody will approve. The scientific data you can take from the patient's home is not clean. And there were several reasons why that innovation would not be adopted at scale. When COVID happened, remote patient monitoring became a big one. People were starting to engage patients at homes. They sent nurses for blood draws. They completely flipped the model from a patient coming to a hospital or a site to people going to the home or collecting data. Right now, we're in what we call decentralized trials, which means they're both in the sites and in the home. So, for example, if you were in a medication for 12, you have 12 visits, maybe 6 visits are now remote visits, and 6 visits are visits to the hospital. So, that has completely changed how work is done, the infrastructure, the technology, the workflow, how people do, and so on and so forth. So, what was a resistance to change has slowly moved the needle towards a new model, and now you have to be able to impact things from that standpoint. Similarly, as I said before, people were like, I know what happens to patients and sites, but I need to collect clean data because sponsors say I have so much money, I have to make sure I collect this data and submit it, because only if I can submit clean data can I get it approved. But they also realize that if you don't bring the sites along, you will not recruit patients effectively. If you don't bring the patient experience along, the patients won't adopt the medicine. That it has flipped the model to being much more patient centric, much more site centric in terms of how you engage. Again, innovation is happening. This industry is a fast follower model. So you have to prove it. So there will be a couple of innovators who will adopt new models, new technology, either prove it or disprove it. We are very trial oriented. So there's always evidence that this innovation worked, didn't work. But once the evidence is clear, there's a domino effect. People are not just half baked about it. So, as I said, the electronic data capture in 2002 may have been 5%. By 2005, it was 60%. By 2007, 8, it was 100%. So the rate of adoption and innovation is quite significant, but you need different ways in which to prove that innovation can be experimented and then it's proven to work.
Yes. Exactly. So I think what am I hearing is because obviously it's a human being well-being and related to their life. So obviously they have to some regulations in place. It has to be proven, and once it's been proven, then it's having a domino effect, and it really exponentially rise. This is one of the positive outcomes of the COVID 19, the pandemic, that there were a pretty fast pace of adoption of the digital transformation throughout different sectors. Sometimes you need some kind of force to make it happen, and then eventually you will see that definitely that really help us to move forward from rather than from A to B, it may be A to Z. So that being said, let's get into a bit of the final couple of questions. So, what are you doing right now? What keeps you awake at night about the health and life sciences sector? And the second question would be, what's your vision about the future in next 5 to 10 years?
So, not what keeps me awake or whatever.
Yeah.
I'm a passionate believer that healthcare transformation has to happen from a patient centric standpoint. The patient at the center needs to make sure that their lives get better. And so I would say that the whole healthcare industry should be flipping itself to a patient centric model. And it is going to happen, and it is happening, and it is slowly becoming such that each of them, individuals, will have more accountability for their own healthcare. Personally, I'm a what you call a quantify me guy. I have a Fitbit, I have an Apple Watch, I have a Withing scales. I look at my Oral B toothbrush. I'm quantifying every aspect of my health to give me a rear view mirror around how things are going on, including getting my medical records integrated to my health records within my phone, so on and so forth. Again, why is that important? Is because as we start to look into the future, we know medicines don't work broadly for everybody. It's personalized medicine. It is personalized to who you are, your DNA, your lifestyle, and your way of living. And therefore, as we start to look to the future, more and more, this patient centric view is going to give you a very targeted way of being more personalized in care. And I think that that's where the future is in 8 to 10 years. Who knows? You're going to a CVS and you see like a Coke machine, and you're putting in your DNA, and it is telling you exactly the right medication which will work for you based on you and your lifestyle. Is it 10 years from now, 20 years from now? But that's kind of where the future is. Personalized medicine, patient centric, and it's all about you.
Wonderful. Yeah, patient centric approach and having one to one personalized recommendations and medicine is the way to go. That's great. So let's get into the final two questions, which I try to ask most of my guests. Is what is one of the best advice you got from your mentor which still lives with you, which you always replicate and would like to further replicate it to your mentees in your life?
Yeah, I would say I've had a couple of mentors, and each one gave me a different perspective. The first perspective I would say is customer first. I know everybody tells that, but in the healthcare industry, we're serving a patient, serving a doctor, serving the industry. Really being very humble about that particular perspective is going to be very, very useful to look to transform healthcare. Many people always think I know better, but actually you don't know better. It's the patient, it's the doctor, it's the experience who will know better. So having a very customer focus, I tell that to everybody. Make sure you're listening, you're going out there and seeing how healthcare works, because then you can make some very good transformations and innovations and recommendations. Don't do that in an ivory tower. And
Perfect. Yeah,
uh,
go ahead.
yeah, and the second mentor is about team, and that's the philosophy. They said it's people first. You're only as good as your team, and your team is like five fingers. Not everybody is equal, so you as a leader have to find out what works better for each one, and then bring that together. And your job is to bring a strong fist together from the individual fingers. And so that is also a very critical one, about really looking at what is the right mix of your team, how do you bring them together, and how do you complement that they can work together. So these are two things which I talk about. One is outward facing and one is inward facing.
Great. So, people first and customer first is one of the two advice you would like to give. The second question would be, if you wouldn't be doing the health and life clinical trials and all the research area related work in your life, what would be your alternate career choice?
Um, I think I love to help businesses grow.
Mhm.
And so that's still, I don't think it's an alternate career choice. I continue to do that. I perform it within the healthcare and life sciences industries, but also across several professional services organizations, as well as for individuals. I think you mentioned it before. We're all having a learning culture, a growth culture, and really, I'd love to help people or organizations or platforms grow.
That's great. So, do you have, just for the sake of the awareness for everyone, so if someone would like to reach out to you for any professional help, what is the medium? If you can help walk through a quick couple of steps here.
Yeah, they can reach out to me over LinkedIn, and
Mhm.
I usually respond. And then definitely would love to look to what the individual wants to do, and then to see how I can support them.
Perfect. And all this, your LinkedIn profile and any other related information would be in the show notes. So you can definitely refer that for the people who are viewing or listening to this podcast. And the last question would be, if you would like to capture one word for leadership, what would that be?
I think it's empathy, because if you are not having that empathetic feeling to understand the market, understand the needs of your teams, understand how to make it work, you would just then be, an individual who doesn't have people around them. So I would say empathy is one word I would leave behind for everybody.
Perfect. So, Shri, it definitely was a pleasure talking to you about the different aspects of life, health and life sciences, clinical trials, about the leadership philosophy. I really thoroughly enjoyed our conversation. I'm looking forward to kind of just review and kind of listen in. I would encourage each and every one of you, please provide your feedback in the comments in whichever social platform you're using. Your feedback really help us to kind of grow. As Shri mentioned before as well, we are all learning. Learning mindset is something the key in each and every aspects of the business, whatever the endeavors we are following through. So appreciate any feedback if you guys have over there. So Shri, thank you so much again for providing your time and coming on this to the show.
Thank you. Appreciate it.
Yeah. We hope you enjoyed our show today. If you have any thoughts or questions, feel free to reach out to us on social media or leave a comment. Don't forget, yes, don't forget to subscribe to our podcast on your favorite platform so you never miss an episode. And if you find value in our conversation today, we would be incredibly grateful if you could leave us a rating, reviews, or comments. Again, thank you for tuning in, and we will be back with another episode next week. Till then, keep the conversation going. Let's talk.